Hi, I'm Dr. Michael Richie, and I want to thank you for joining me again this week. What I want to talk about today is a little bit different. You've heard me in the past talk about cataracts, cataract surgery, different options that we have with cataract surgery, different refractive outcomes or cataract surgery upgrades, and that kind of thing. But what I want to talk about today is something a little different. Regardless of what you choose, everybody who goes through cataract surgery goes through a process. And I want to walk you through that process and talk about some of the things that you can expect after you have your cataract surgery. First, the surgery itself is an outpatient procedure. We have an operating room right here at the Crossroads building, and it's a day surgery. So we give you some sedation. You're not allowed to drive yourself within 24 hours after having sedation, so you need a driver. When you go home the day of the surgery, you're going to notice that the eye is a little sore and scratchy. It might feel like there's a stitch or an eyelash. There isn't. That's just the incision, and that's how it feels. Now, most people take a good nap the day of the surgery, and a lot of the scratchy feeling gets better. By morning, after a nap and maybe a good night's sleep, most people feel like the eyes are doing very, very well. Vision will be blurry all day the day we do this. You'll see some glare, you'll see some reflections, you may see some flashes. Some people describe things differently, but don't worry about distortions in your vision. That's very normal. Vision will typically settle in over the course of the next few days or even the next few weeks. We typically consider the eye to be refractively stable by 4 to 6 weeks. What that means is you're ready to update your glasses about 5 weeks after cataract surgery. Now, going beyond that, some people have a lingering scratchy feeling in the eye. That is simply the eye suffering some dryness as you go through the healing process. Reason for that is very simple. When we do surgery, any kind of surgery on the eye, we damage the nerve endings, and those nerve endings take 3 to 6 months to heal. So, although it's rare, most people don't have a scratchy feeling beyond the first week or two. It's not out of the ordinary for some people to take 3 to 6 months for that to get better. Later, as you go down the road, there are a couple of other things that you need to be aware of. First, any sudden change in vision is always abnormal. In cataract surgery, the risk of infection is very, very low, less than 1 in 1,000. But virtually all infections, if they occur in the first week. The symptoms of infection: pain, change in vision, loss in vision, and it will happen over a matter of hours, not days. Call immediately. 2, over time, the capsule that we use to hold the new lens can cloud over. If that clouds over, we may need to do a laser treatment called a YAG laser capsulotomy. And 3, flashing and floaters. New flashes, new floaters are signs and symptoms of, or at least the potential of, retinal detachment. After cataract surgery, risk of retinal detachment is low, about 1 in 500 or less. But if you get new flashes, new floaters, whether or not you've had cataract surgery, come in and let us look. Sometimes the vitreous jelly, as it liquefies, can cause a tear in the retina. Now let me give you the statistics. A retinal detachment, on average, occurs 1 in 10,000 people. Retinal tears occur about 1 in 1,000. So for people with new flashes and new floaters, we want to look to see if you have a retinal tear. If you do, we will fix it with a laser treatment, because if you have a retinal tear, you have a 1 in 10 chance of a retinal detachment. So really, those are the things to keep in mind. A quick review. After cataract surgery, you will have a scratchy feeling in the eye. Don't worry about blurred vision for the first few days. Sudden pain, loss of vision, especially in the first week, could represent infection. Come in right away or call right away. Vision and refractive stability happens at about 4 to 6 weeks. So usually around 5 weeks after surgery, you're ready for your new glasses. About 1 in 5 will suffer a clouding of the capsule behind the implant and need a YAG laser capsulotomy to fix that. And flashes and floaters can be warning signs of retinal detachment. Those are some things to keep in mind as you consider cataract surgery. I hope you find this helpful, and I look forward to next time.